would like to introduce our luncheon keynote speaker, Adele Houghton. Adele is a licensed architect in the state of Texas and a LEED accredited professional. She has specialties in building design and construction, operations and maintenance, and neighborhood development. She's president of BioSitu LLC, a strategic consulting company dedicated to leveraging environmental sustainability to enhance community health. She received a Master of Public Health and a certificate in Public Health Informatics from Johns Hopkins Bloomberg School of Public Health. Adele came to St. Paul yesterday and led a workshop with Central Corridor multifamily housing developers, public health officials, and city planners. It was very informative, and so I'm very excited to learn more from Adele right now. So please join me in welcoming Adele Houghton.
Computer's gonna fall off. All right, thank you. Thank you to the Impact Conference for inviting me to present today, and also to the Minnesota Pollution Control Agency and the City of St. Paul for inviting me yesterday. I appreciated the invitation. It was a really exciting day. And while I'm not going to talk specifically about the workshop, I am going to give you all some of the information that I shared yesterday and walk through pieces of what we talked about, as well as sort of moving a little bit further beyond our discussion yesterday. So this course is accredited for 1 CEU credit for GBCI as well as AIA. Basically what I'm going to talk about today is just to give you an introduction on how it's possible to use contextual health data, which is population health data specific to building occupants and the surrounding neighborhood, to add value to the design process, regardless of the specific health topic under consideration. So we're going to look at two different types of health issues. We're going to look at chronic disease and the health impacts of climate change. I'm looking at two quite different health impacts on purpose, because I want you all not to feel like health is something that you have to kind of fit into one box of, asthma or obesity or flooding, that it's actually something that can be applied overall to a project, depending on what the priorities of the project are. So we're going to look at kind of 4 sections in the presentation. First, for those of us who are like me when I first started looking into public health, maybe not as familiar about where health data comes from and what its purpose is, I'll just give you a very brief introduction to public health agencies, how they collect data, and how they use it. I'm then going to talk very briefly about how design can set the context for a healthy or unhealthy condition. And again, we'll be looking at chronic disease and climate change. Then we'll briefly review some of the research that I've done that links green building and community health in a specific way. And the purpose of this is to just show you that there actually is a great value in looking at the specific context around a site and what the health needs are around that site. A lot of the design strategies that we're going to talk about later in the presentation are green building design strategies that we're all familiar with, those of us who work in the green building industry. What's different about the approach that I'm suggesting that you might consider taking after hearing this presentation today is that prioritizing those design strategies can be really useful if you focus on the specific health needs of the population, and that you might prioritize differently if you understood what those health issues were. And so then I'm going to walk through the steps of the project delivery process and talk about specifically how you might apply health data to each step of the project delivery process. So let's get started with public health data. So public health agencies collect data on a variety of different health outcomes. The reason they do this is to identify and respond to outbreaks. And I'm going to show you 3 different ways that they collect this data. The one that we're looking at right now is more of a long-term trend. There's a project through Health and Human Services called Healthy People that is updated every 10 years that uses historical data In this case, we're looking at obesity in children and adolescents. And then it sets a target and says, in the next 10 years, we'd like to reduce whatever that health condition is by a certain percentage. The thing that I think is interesting also about this slide is that it's showing not just obesity and a target for the future, but it's also showing that the children and adolescents who live in the lowest segment of economic prosperity in the US have twice the obesity rate of the children that live in the highest segment. So there's a disparity issue here that is underlying the health outcomes. And so what you're going to see me talk about today are both health outcomes as well as sociodemographic risk factors. That is, risk factors that are kind of underneath, kind of foundational to our access to being able to live in a healthy way. Another way that public health gathers data is to look at more immediate outbreaks. And this is something that you might be more familiar with. So when you hear there's been a lot of conversation in the news recently about a Middle Eastern respiratory illness, that there's been an outbreak in the US. The reason why the CDC is able to track and publicize that these outbreaks are happening is because there are certain diseases that are what are called reportable. So they're when a hospital admits and diagnoses a patient with, for example, in this case, influenza or an influenza-like illness, they report that to the health department, who then reports that to the National Centers for Disease Control. And they're able to, through tracking historical trends as well as sort of trends over time, they're able to project out and understand when an outbreak has actually started to happen. Because an outbreak could be one person, as what happened with this Middle Eastern respiratory illness, or with influenza, there's a higher number of cases before we decide it's an outbreak. So this is data that you're beginning to see is available on the internet, as was the previous data set, and as is this one. So we're starting to see that there's more and more access to the public of these data sets. This slide came from the Minnesota Environmental Public Health Tracking Program. They have a great portal where you can look up not only health indicators like cancer, happens to show you by county what the cancer rates are in Minnesota, but because it's looking at environmental conditions, it's also looking at the environmental correlates that could lead to cancer. So there are certain environmental conditions that are risk factors for cancer. And so you see also indicators on this portal that are not just health outcomes, but they are some of the underlying causes of cancer. Just to give you an example, the national network includes information about air quality, asthma, birth defects, cancer, carbon monoxide, childhood lead poisoning, drinking water, heart attacks, heat-related illness, and reproductive outcomes. So it's quite a range of environmentally related illnesses. So that's just a very quick overview, just to give you an idea that when I'm talking about health data, I'm actually talking about data, and it's at the population level. Population can be defined as 2 people or more. It doesn't necessarily have to mean a huge number of people, so keep that in mind when we talk about population for the rest of the day. So now we're going to quickly talk about the role design can play in addressing 2 of the most pressing health concerns in the US, chronic disease and the health impacts of climate change. Maybe we should move to the boarding area. I don't know, what do y'all think? All right, so first we're gonna talk about chronic disease. Chronic disease, as you all probably know, is by far the highest cause of mortality in the US. It accounts for 75% of the $2.6 trillion that are spent each year on medical care. The medical conditions that are associated with what are called modifiable risk factors, these are risk factors that we have some control over. Now, whether an individual has a control over that or whether we as designers have some control over that, it depends. But we're talking about things like smoking and nutrition and keeping a healthy weight, physical activity. Those medical conditions represent 60% of the most costly medical conditions in the US. And the same 6 conditions accounted for 30% of the increase in medical care spending from 1987 to 2000. So when you start thinking about what is our role and what's the significance of our ability in terms of changing the built environment to reduce the costs of sort of escalating healthcare expenditures in the US, we actually are able to make a very strong impact on some of the most costly reasons for why we're having this kind of overrun of healthcare costs. So while the built environment isn't going to be able to solve this challenge all by itself, it is a major contributor to both the problem and its solution. There's a lot of evidence out there showing that. And this slide just shows you that a number of studies are showing that if you build an environment that is supportive of reducing these modifiable risk factors, that you can actually be twice as effective in reducing those health outcomes than just simply providing access to care. And I say that not saying that we don't need to continue to try and provide access to care, but we spend more than 80% of our healthcare dollars just simply providing access to care, when we probably should also be looking more into prevention, and particularly into how we can change the environment to be supportive of a healthy lifestyle. So we see a similar scenario when we look at the health effects of climate change. I imagine you all have been bombarded with news about climate change over the past few weeks. There's been the release of a number of reports from the Intergovernmental Panel on Climate Change, as well as the National Climate Assessment. What we're going to be talking about today is heat-related events. Heat waves and what we call extreme heat events are the largest killer in terms of natural disasters in the US every year. They're a problem, particularly in areas of the country like Minnesota, where people aren't used to those levels of heat, and particularly the humidity combined with the heat. And particularly in places where there's not sort of across-the-board access to air conditioning. This slide is simply showing that a study looking at 6 of the billion-dollar events across the US over the past decade resulted in an additional $14 billion above and beyond the estimated losses in property, assets, and infrastructure that characterize our typical accounting of economic effects of natural disasters. So when we normally hear about, the number of billion-dollar natural disasters is going up every year, that does not include any of these health effects. So we're talking about there's a massive amount of money that's being spent in terms of lives lost prematurely, and also actual costs of medical bills directly related to these extreme events that's not even being incorporated into that billion-dollar figure. So again, similar to chronic disease, the built environment has a role to play here, and this study is showing an estimate that for every dollar of prevention that's related to changes to the environment, that there is a $15 net present value avoidance of future damages. So this is actually a very good return on investment if we start looking at our built environment in that way. So now we're just going to move on quickly to a few examples of the research that I've done that is looking at is there evidence that there is a role for green building specifically to play in improving community health. So as part of a larger study, I performed a literature review to identify the evidence of associations between green building strategies. And in this case, I was using LEED as my definition, LEED credits that you'll see up here on the screen. And comparing those LEED credits with adverse health effects from 2 climatic events. I looked at extreme heat and flooding, which are the 2 most deadly events in Austin, Texas, which is where I was really focusing my research. What I found was that 13 LEED for new construction credits had the potential to reduce the risk of negative health outcomes associated with extreme heat events, and 12 new construction credits had the same potential for flooding. And you can see, if you're close enough, you'll see that these credits are not only in the sustainable sites category, they cover the entire rating system except for materials and resources. So now I'm just going to walk you through really quickly the literature review itself. Again, we're looking at the public health literature, and is there any evidence to support green building strategies actually being able to lead to improved health outcomes? And so if you're actually using a LEED credit in that way, you're going to be focusing on two environmental determinants of health, one related to population exposure and one related to built environment. And I want to be really clear about this, because normally in the green building sector, when we talk about resilience, we're talking about the resilience of the built environment. What I'm talking about here from a public health context is adding into it the additional component of the resilience of the population that is living and passing through and working in that environment. So those are the environmental determinants of health. The LEED credits can address a risk of exposure either through reducing exposure in the first place. So if you think about a heat event, making it less likely that a person is going to be exposed to an extreme temperature. It also could improve what's called passive survivability of the building, which is the ability of the building to continue to function when the utilities are out. So if a LEED credit is implemented with its potential impact on community resilience in mind, the implementation could result in co-benefits both to health and to the built environment, again, because we're looking at both of those categories simultaneously. So what did I find? I'm just, on these slides, we're just looking at the results from the extreme heat analysis. What we found was that the environmental determinants of health related to extreme heat were the percentage of vegetation in neighborhoods with vulnerable populations and exposure to high temperatures in urban areas. And again, you can see the combination there of an environmental factor and a person factor. And then in terms of the environmental quality and energy and atmosphere and indoor environmental quality sections, power outages exacerbated by heat were also identified as an environmental determinant of health. And the most recent heat wave here in Minnesota, we saw a number of mortalities associated with power outages. So that is certainly something that you all is directly relevant to you. In terms of risk of exposure, LEED credits reduce that risk by reducing the urban heat island effect. And that practice was also identified as the most salient co-benefit to the built environment. In terms of the co-benefits to public health, we saw a reduced vulnerability to heat stress, reduced heat-related injuries and death, and again, passive survivability. So this ability to what we call shelter in place instead of being forced to go to an emergency shelter during an event. Based on the results of that literature review, I performed several spatial analyses to determine whether or not green building projects have been used in Austin, Texas, and Chicago, Illinois over the past decade as a tool to increase neighborhood resilience to health and the environmental effects of those two events, heat and flooding. I'm showing you here Chicago, which I really used as a comparison to Austin to validate my results of my analysis, because Chicago is closer to you guys. The results on the left are showing the number of LEED certified projects in a census tract, and a census tract is essentially like a large neighborhood, sort of like a super neighborhood, on top of a heat vulnerability index. So the worst vulnerability are in the census tracts that are red and orange. So you can see that there is some clustering of LEED credits, particularly in the middle of Chicago. But on the right-hand side, what you can see is the hotspot analysis, and that shows that LEED certified projects are not clustered in most of the vulnerable neighborhoods. So the results of this are basically that while there's a potential for these LEED projects to have been focusing on credits that would help reduce vulnerability to extreme heat events, that in fact that wasn't what was happening, probably because it wasn't on the radar screen of the design team. And in fact, the lead projects in the first place are clustered in low vulnerability neighborhoods. So we've got a sort of a double problem in this situation. And those neighborhoods, arguably maybe are in less need of those co-benefits that the green buildings could provide. So how does this apply to the specific, a specific project? I'm going to go through a few examples here, walking through the project delivery process. And I'm going to use, for some of these sections, actually a local project called that's sponsored by the USGBC Minnesota, that's called the Dynamic Green Home, which is a rehab that's here in Frogtown on the Central Corridor. Is anybody in the room working on that project? Okay. Anybody? Are you? No? Okay. So nobody's in here who's going to keep me honest. All right. I'm going to say that what I know about this project is what I read on the internet, and they've got a great blog. So if I say anything that's incorrect, please correct me during the Q&A. But basically, what I'm showing here is that it's located in the Central Corridor, which is great, near the light rail system. It's also located in what's called the Energy Corridor. So it has access to some of these additional incentives around energy efficiency, renewable energy, et cetera. Okay, so let's get started with the conceptualization and visioning phase of the project delivery process. So this is the phase that's really the ideal time to perform a contextual health data analysis because your project is still wide open. In some cases, you haven't even chosen your site yet. And so you simply need to, if you want to follow the approach that I'm advocating, you would just include health metrics alongside all of the other data that you would gather, such as economic data, environmental data, other project goals. And so the health data would just be another piece of that larger picture that you're pulling together to help you design the project. So in terms of the health concerns of this neighborhood, asthma is one of the major concerns. This is actually from a health impact assessment that was done of the corridor. You can see the source down at the bottom. And they identified, just for the corridor itself, these 6 indicators. Asthma, and another way of talking about asthma is it's a lower respiratory disease. And chronic lower respiratory disease is the 4th leading cause of death in Ramsey County. So this is an issue both locally to the Central Corridor. It's also an issue within Ramsey County. There's a higher rate of asthma along the Central Corridor, as you can see here on the left in the green box, than in the rest of the Twin Cities or in Minneapolis. And the highest rates are near downtown in the capital submarkets, which is where Frogtown is located. So what are the sociodemographic risk factors for chronic lower respiratory disease? First would be low socioeconomic status, which is basically people living in poverty, people of color who are subject to structural racism and sort of structural situations that give them fewer opportunities for living and education, et cetera, and kind of keep them in this kind of cycle of poverty. That's what low socioeconomic status, or low SES, means. Children and the elderly are always going to be vulnerable groups because they have certain physiological characteristics that tend to make them more vulnerable. And then pre-existing conditions, health conditions, such as other respiratory problems. In terms of behavioral or environmental risk factors associated with chronic lower respiratory disease, a lot of these probably are familiar to those of us working in green buildings. So tobacco, secondhand smoke, something that we take out of the campus when we perform a LEED project, indoor air quality, indoor air pollutants, outdoor air pollutants, allergens, and occupational agents. Looking again, so since I'm walking you through this, looking at both of these different types of disease. So looking at climate change and heat events, the sociodemographic risk factors, again, are low SES, children, elderly living alone or elderly living in nursing homes. This is a particularly big issue. We see a lot of mortalities related to elderly living alone during extreme heat events. There was a real tragic event in France. I think it was in 2003, 2005. They had this massive heat wave in Europe, and there was a major percentage of people who actually died were elderly living alone in upper floors of apartment buildings. And then again, pre-existing conditions. And in terms of heat, the pre-existing conditions are diabetes, respiratory disease, and cardiovascular disease. So you can see that if you already have asthma and you're elderly, you're both at a higher risk of a negative health effect, both for asthma or for lower chronic respiratory disease, as well as for heat events. For behavioral environmental risk factors, we see a lot of things that we're familiar with, urban heat island effect. But then in addition to that, access to air conditioning is really important, and that's something that I think that there's been a little bit of a tension between public health and green building because we're trying, as green building professionals, we're trying to reduce energy use, but that there actually is a real key need for air conditioning, particularly for these vulnerable populations during these events. People who are in outdoor occupations and people who do a lot of recreation, like kids playing soccer outside, that sort of thing, tend to be at higher risk. Again, top floors of buildings and power outages, like we mentioned before. So, let's look at Frogtown itself, and you can see that the site is the green star. And in terms of one of those sociodemographic risk factors that I mentioned, the low socioeconomic status, the Frogtown neighborhood in general has a much higher percentage of Black and African American as well as Asian or Pacific Islander populations. You can see that in the green box over on the left. And there's also, if you look at the percentage of people of color map that was developed for the health impact assessment, you can see that the Frogtown project is located in a very highly vulnerable block. In terms of household income, you can also see that Frogtown has a much higher percentage of population in the lowest socioeconomic segment. So for moving on to environmental risk factors and looking at the specific site, this is a really great portal that you can find. It's actually specific to the Twin Cities. It's called the Seed Environmental Justice Atlas, and it allows you to kind of layer different environmental justice concerns on top of each other in a single map, so you can sort of compare and contrast potential vulnerabilities and risk factors. And what this is showing about Frogtown, and particularly specifically around this site, is that there's a lot of blighted housing. Now, the actual project itself is one of the identified blighted houses. So they did a good job of picking the site, and obviously once the site has been renovated, it will no longer be blighted. But it's also something to think about in terms of being surrounded by a lot of other what's so-called blighted housing, because they could theoretically harbor pests, pests being one of the triggers for asthma. There's also a leak site, an environmental contamination leak site 1 block away from the site, and it's very close to University Avenue, which is great because it's really close to the light rail, but these higher, busier streets also produce more particulate matter, more ground level ozone, et cetera, and so those can be triggers for asthma. So looking at climate change and health with the same portal, we see that one of the environmental risk factors is impervious surface or urban heat island. We can't really see that from this particular slide, but we can see that there's one pocket park that's a few blocks away So it's something that you would want to check on to see, what's the level of impervious surface around this site? Is it something that we could potentially mitigate through the project? In terms of access to air conditioning and potential proper insulation, again, this project, once it's finished, will be hopefully retrofitted to take care of those potential problems. But you might be surrounded by neighbors who do not have that level of environmental security. And then you can see in the red, what the red and the orange mean is looking at what's called energy poverty, which is the ability of the household to pay their electrical bill. So if you're in a highly vulnerable energy poverty neighborhood, then you have a higher percentage of neighbors, and potentially yourself as well, who during a heat event might not be able to pay the higher air conditioning bill because you've got higher temperatures, et cetera. So that makes you even more vulnerable to a potential negative health outcome. Okay, so based on that very quick review of just a few health issues and underlying what we call social determinants of health, I'm just going to give you a few examples of the types of design strategies that might come out of what's called a health impact assessment. So the health impact assessment would happen during the schematic design phase usually. It needs to be early enough in the project that you could actually make recommendations that would change the design or alter it in some way, but it can't happen so early that you don't have anything that you can respond to. And I'm going to actually look at this in terms of 4 different types of design strategies. And I'm going to start with infrastructure, and I do this on purpose because I think that a lot of the time we kind of stick ourselves a little bit in kind of stovepipes or boxes, thinking, well, I'm an architect, I only work on my one site. And when we start talking about health, all of a sudden we start talking about multiple scales. There certainly are things that you can do on your own site that could help benefit or advance a larger goal related to community or neighborhood development. But I think a lot of what ends up happening when you start bringing a health approach is you start having conversations with people that you don't normally have during the design process. So I hope I don't turn you off by talking about infrastructure. I'm also going to talk about occupants, not just the building design itself. So first, what we might consider in terms of recommendations of the surrounding infrastructure is testing the outdoor air quality. A lot of times that doesn't happen. So I mentioned there are some risk factors associated with this site, but we don't actually know what is the outdoor air quality. Is there a high level of ozone or particulate matter or carbon monoxide? Is there a high level of pollen? I know that that's something people have been mentioning to me as being a real issue up here. Now, in terms of the building design, there are certain things that you can do to change the building design to mitigate some of those outdoor air pollutants. But at a larger scale, you can also talk to the city about mitigation measures like traffic calming or lowering the neighborhood speed limits or erecting pollution barriers, whether they be concrete or vegetative. And to combat the urban heat island effect, I loved this is a street view from Google, and it looks like there's a nice tree canopy, but it's possible that the HIA might look for other opportunities to expand that tree canopy and shade the house more effectively. Also talking to the city about reducing impervious surfaces or dark impervious surfaces like asphalt roads. That can also make a really big difference. In a lot of parts of the country, the streets and the sidewalks actually take up 20% or more of the surface area. So we're actually talking about a large contributor to the urban heat island. Moving on to building design, which is where we're a little bit more focused in this room. The dynamic green home is incorporating a number of building design strategies that would be aimed at reducing asthma triggers, such as removing their carpeting and focusing on low and no VOC paints and sealants. Other considerations they might include installing window screens to encourage the occupants to use natural ventilation and avoiding landscaping that might act as an asthma trigger. Also installing air conditioning filters that are both high quality but not so expensive. I've heard so many horror stories about low-income housing and installing filters that are too expensive for the occupants to actually ever change them out. Much of the regular envelope maintenance that's going to take place as part of the renovation is going to remove a lot of the other asthma triggers, such as ways for pests to get in and out of the building, as well as mold. To protect the occupants from heat events, the health impact assessment might also include suggesting increasing insulation or installing radiant barriers in the attic, replacing the roof with a lighter colored roof, installing photovoltaics, which you might be able to get a grant for because you're in the energy corridor. And those photovoltaics might even be considered to be directly connected to like a generator or one area of the house so that there's a place for people to gather during these heat events. Because of where you guys are located up here in Minnesota, you might also just consider fitting out the basement and turning that sort of into your localized cooling center to make use of during a heat event. And the dynamic green home is also looking at changing out the vegetation, making it more native, and putting in a rain garden, and all of that will help with the urban heat island effect. So in terms of the building occupants, this is something that I think a lot of time gets left out, but the building isn't going to function properly if the occupants aren't taking care of it. So to control asthma triggers, it's important to keep the pests and the mold out of the building by continuing to seal up those cracks and holes as they come up, and looking for and addressing leaks and places where water is infiltrating that could lead to mold. It's also important to use low-emitting cleaners and pest control, because those are products that we use to keep our building clean and try and keep the pests out, but they can actually be as much of an asthma trigger as what they're trying to fix. And again, the dynamic green home has started down this path by following the 7 principles of the healthy homes, which was published by the National Center for Healthy Homes. They've got a nice blog post about it. And it includes a principle about maintenance. Protecting occupants during a heat event, it's important to understand, again, that the air conditioning or some type of cooling is necessary, particularly when the temperature gets above 90 degrees relative temperature, because after that point, your body isn't really able to cool itself down on its own, and you can actually exacerbate the process of overheating by using things like fans. So it is really important to find a cool place to sleep, particularly at night. A lot of what happens with these heat waves is as the heat wave goes on, the nighttime temperatures stay higher and higher and higher. That's when we start seeing even higher levels of mortality. So nighttime cooling is really important. In terms of the surrounding community, this is an opportunity to start talking to neighbors about blighted housing and pest control and maintenance, talking about outdoor air quality, if there are ways for the neighborhood to get together or work with the city about some of those suggestions I made before about infrastructure. With climate change, there's also consideration about neighborhood cooling centers, maybe like a library or school could be used. Also, buddy systems. I mentioned that elderly are particularly vulnerable. A lot of cities have started creating these buddy systems where you go and check up on your elderly neighbors during heat events. We talked yesterday about maybe adding public water fountains, and also tree planting and other urban heat island mitigation strategies. So I've just run through a huge number of suggestions that could come out of a health impact assessment, and I was just looking at 2 items. So hopefully I gave you a brief understanding of some things that you probably would have prioritized anyway, but some other things that you might not have thought about. And now I'm just going to move quickly through the rest of the project delivery process. Once you've finished with the schematic design phase, the design development stage is when you really start developing the design itself, and that's when you normally would use some sort of computer program like a building information modeling system. Now, you might not do that on a small house as a renovation, but since we were talking about the dynamic green home, I just stuck the picture up there. But I think the key point here is that, I've mentioned and I've showed you guys a number of different types of data sets. There's a lot of interest in the building information management system world, as well as in the geographic information system, GIS world, of what's the purpose of these two different tools? Because they're basically both just computer databases that are connected to some sort of geolocation. How can we use them together? How can we make them more streamlined? And a lot of teams have already started incorporating more kind of environmental, stormwater, other types of data that come from a GIS mapping system. They've incorporated them into the BIM system to help inform design. So all I'm saying is that actually there's all this data out there that's health data as well. You could also incorporate that. So as an example, if you're talking about stormwater, rather than just adding the floodplain maps into your BIM model, you might also look at maps of the neighborhoods with the highest rate of complaints about combined sewer overflow, which is something that's a big deal up in the Midwest. I don't know if Minnesota has this issue, but I know that Wisconsin and Illinois do. Maybe the density of populations who are vulnerable to waterborne disease. And also, once you've incorporated this data into your BIM model, a lot of BIM models have started allowing you to track your lead progress for certain credits through the computer model. So that's, again, something that from the recommendations and the prioritization that you walk through in the health impact assessment, you could then apply to BIM. So not just checking to see, okay, is our project on track to meet the stormwater quantity and quality credits because we've incorporated this data from GIS, but are there other lead credits that we're tracking because of their health benefit? You could just simply flag them in your BIM software. So there are a lot of ways that health could be integrated into BIM. It doesn't necessarily have to be the data set itself. It could just be the prioritization that comes out of that analysis that was done in a previous stage. So in the construction document stage, usually the project focuses on developing the technical requirements for translating the building design into the actual built building. And this is the stage when a lot of the time you end up with value engineering, which basically means cost cutting. And all of us who work in green building know that this is a time when a lot of our strategies that we're been focusing on get cut or attempt to be cut. And I think that similar strategies can be used around health as we use around green building. So essentially embedding the priorities that we set around health earlier in the project, embedding them so much into the design that they can't be cut. So I'll give an example. I was working on a hospital where we tried really hard to follow the active design guideline requirement around making stairs more accessible to people, easier to find, et cetera. And unfortunately, they were still located. They were going to be the stairs that are for like back of house stairs for the staff to go up and down in between floors. Unfortunately, they were still kind of located where they were going to be located before we tried to make them more appealing, and they still were going to be behind sort of closed steel doors. So, of course, when we went through the value engineering process, the contractor said, well, why are we spending all this money on upgraded paint and finishes, et cetera, and that got cut. And so, basically our attempt to make those stairs more along the lines of an active design guidelines principles failed. These pictures are actually a success. This is Via Verde, which is a project, it's a mixed income housing project in New York City. And basically they incorporated into the body of the project a number of strategies to try and encourage people to be more active. And you can even see, like the whole entry to the project, once you're inside the courtyard, you're looking at the inside of the courtyard, is a big staircase. And then there are all of these like fruit trees up on top, and they've got a community garden that everybody helps to cultivate. So there are so many aspects of the way the building was designed, its footprint, its massing, that if they had taken all of that vegetation away, it sort of would have destroyed the project. And so I think they did a really good job of showing what I'm talking about in terms of incorporating active design into the body of the design. So moving on to construction administration, If you are also incorporating health data into your BIM model, you would want to compile your baseline health data sets during the construction documents phase. And then during the construction administration, that's when you start tracking how you're doing on meeting those goals. The construction administration phase itself is the process of maintaining quality control during construction. So again, this is very similar to what a lot of us do in green building consulting. When during construction administration, we're trying to make sure that all of those strategies and that we've been tracking and the metrics that we've basically created a guidance for ourselves during design. We need to make sure that they're actually followed through during construction. You would do the exact same thing with health. And as I mentioned, a lot of those strategies were taken from a green building design guideline. So this assessment could be done sort of hand in hand with your lead consulting. So finally, moving into the occupancy phase, this is an area, again, that I find, unfortunately, a lot of the time the design team is then sort of moving on to the next project and not incorporated into the occupancy phase. And that is unfortunate for green building performance. It's also unfortunate for tracking whether or not the goals that you set for health have also been have followed through and actually have met your goals. And because what we started out with at the beginning of this talk was actual data, which could be baseline data, you can use those metrics to check after occupancy, what is the change in the health of our occupants, or are we meeting the goals that we set for ourselves? Now, in some cases, you might need to look for baseline occupant health data that might be at a national scale if you don't know what your population is. This particular case study was a before and after because it's a renovation of an existing building with an existing population that was not displaced. So what they were able to find was it was a combination of a green building retrofit and healthy housing retrofit. So looking at some of the things I was talking about asthma triggers, as well as some other ways of making the building a healthier building to be in. And so there was a health component to it. Previous to the move, they looked at a number of different health issues, as you can see here, among adults and children. This happens to be adults. And then it looks at how did those health conditions change after 1 year after occupancy, after the renovation. And you can see, and I'll just read you because I'm sure it's too small, but chronic bronchitis, hay fever, sinusitis, hypertension, et cetera, et cetera. All of the health factors went way down after 1 year after after occupancy, except for overweight, which is the same. And the reason for that is because they didn't do anything related to trying to improve access to active living. But this just goes to show you that this is something that can be incorporated into a post-occupancy evaluation. In terms of measurement and verification, as I mentioned before, through my research, there are a lot of energy and atmosphere strategies that can also benefit health. So those aspects could also be incorporated into a measurement and verification program. So I'm just going to close with a just very quick gloss over for our planning people in the room about ways that health data might actually also impact larger land use policy. First of all, looking at zoning requirements that could target green building strategies to vulnerable neighborhoods. As I showed you in the research, we don't know where those vulnerable neighborhoods are until we do the actual assessment, but we have the tools and we have access to the data to be able to do that now, and it's a really useful tool. And again, then prioritizing those interventions in those neighborhoods and potentially providing some sort of either change in the code or some kind of grant program or something to encourage people to use certain green building strategies in those neighborhoods, as well as maybe a city tree planting program, for example. You might want to target that in a neighborhood that both has a lot of impervious surface and a highly vulnerable population. incorporating health vulnerability data into the existing planning process. There are a number of cities around the country that have started requiring health impact assessments as part of land use planning. We had a conversation yesterday about the pros and cons of incorporating it into environmental impact assessments, but even if it's not incorporated into an EIA, it could be a standalone document that helps inform that EIA. And we heard also that the Minnesota Department of Health has done an impact assessment, a health impact assessment of the environmental impact scorecard. So there are certain ways that these two processes can start coming together. And then finally, this data can be used to educate and actively engage these vulnerable neighborhoods to give them a feeling of empowerment to actually be able to improve their own quality of life. So just in conclusion, I hope I've convinced you that the built environment is an influential driver both in health and disease. It can be difficult to trace a direct line of cause and effect between one design feature and one health outcome, but we're seeing a growing body of evidence that points to the potential for design to play a more active role in supporting health outcomes and reducing exposure to conditions that can lead to negative health outcomes. This is particularly true for efforts to reduce the burden of chronic disease and enhance community resilience to climate change. And I would argue that green building practices are particularly useful tools for this effort because so many of them lie at the intersection of health and efficiency.